My name is Koren Fisher. I'm an assistant professor in the Department of Kinesiology at California State University, Fullerton, and in my work I explore the relationships between physical activity, sedentary behavior, and health in middle-aged and older adults. I want to share some information with you today about physical activity for breast cancer survivors. I will explain what I mean by physical activity and also why it's important. I will also discuss physical activity recommendations for breast cancer survivors and share some tips for being physically active. So what do I mean when I say physical activity? Physical activity is any movement produced by our muscles that requires us to use more energy than we use at rest. Physical activity can be as simple as going for a brisk walk, or it can be more structured and organized, such as attending an exercise class. Why is physical activity important? You have probably heard of the many health benefits associated with physical activity. Being physically active can reduce your risk of many health conditions, including heart disease and diabetes. Activity also protects against bone loss and may help with weight management. Physical activity will also help you to maintain or improve your ability to perform daily tasks, such as grocery shopping or doing laundry. You may also find that physical activity improves your overall quality of life. The evidence shows that physical inactivity is a risk factor for breast cancer. The good news is that you have the power to alter your level of activity to positively influence your health. Specific to breast cancer survivors, physical activity may decrease cancer-related fatigue and decrease the risk of cancer-related mortality in the future. It may also help you feel better, improve your mood, and decrease levels of anxiety. The physical activity guidelines for breast cancer survivors are the same as any other healthy adult. These guidelines are put forth by the United States Department of Health and Human Services, and they recommend that adults participate in at least 150 minutes of moderate intensity aerobic activity each week. Moderate physical activities are those activities that make you breathe harder than normal and your heart beat faster. During moderate physical activity, you should still be able to hold a conversation. Examples include brisk walking and playing tennis. If you prefer more intense aerobic activities, you can meet the physical activity recommendations by doing at least 75 minutes of vigorous physical activities such as jogging or swimming laps. You may also choose to do a combination of moderate and vigorous physical activities to meet the guidelines. The guidelines also recommend that you perform muscle strengthening activities 2 or more days per week. These activities may make your muscles feel tired and a little sore, but they are important in helping you to maintain or regain your strength, as well as having many other health benefits. Weight training, cycling with resistance, and doing yard work are all examples. Don't feel overwhelmed by the amount of physical activity you should be doing each week. 150 minutes sounds like a lot of time, but depending on where you are in your cancer journey, it may not be a realistic starting point. The good news is that you will get some benefit from any physical activity that you do. You can begin by being physically active for just 10 minutes at a time. If your fitness and energy levels allow, you can increase the length of time you are physically active. It's best to spread your physical activity out over the week. 150 minutes per week works out to approximately 30 minutes per day on most days. When you think about it in those terms, it seems a lot more manageable. The bottom line is doing something is better than nothing, and if you are already active, doing more is always better. Many cancer survivors may still find it challenging to be physically active. You may feel as though you do not have enough time, energy, or motivation to be active. On these days, focus on reducing the length of time you spend sitting, or on interrupting your periods of sitting more often. Reducing your sedentary behaviors will also provide you with many health benefits. There are additional ways to overcome the challenges to being active. Try adding physical activity to your daily routine. For example, walk or ride your bike to work, walk the dog, or park farther from your destination. Schedule physical activity during the times of day that you feel most energetic. If you give it a try for 10 minutes, you may find that being physically active increases your energy level. Try inviting a friend to exercise with you on a regular basis so it becomes routine. You can also join an exercise class or group that interests you. If you enjoy yourself, it's more likely that you'll stick with it. Sometimes having support from other people can be beneficial, and that support can come in many forms. You could have someone remind you to be active, watch the kids, or join you in your activity. Anyone can act as a support, whether it be a friend, family member, neighbor, or coworker. Finding sources of support to help you maintain or increase your physical activity may provide you with new opportunities to be physically active and increase your odds of sticking with it. Set yourself up for success by discovering the types of support that work best for you. When it comes down to it, some activity is better than none, and if you are already active, doing more is always better.